Hello and welcome to the Voice of the Patient podcast. We are the podcast working to change lives, that is, improve the quality of life through not only hearing, but truly listening to the voice of the patient.
Hi again, everybody, and welcome again to the fourth installment of this mini-series on mental health. You're listening to the Voice of the Patient, and my name is David Reed. Well, I am joining Zach Stearns, who is your host of the Voice of the Patient, and I am his sidekick for this entire series, and we are sidekicking along Sean Hagey, who is also here, talking about his mental illness. We're going to cover some dark, uncomfortable, potentially scary material. If you have any kids listening, the material we're going to discuss probably isn't appropriate for them. So we just want to go over a couple things before we get started. Please listen to the entire series, but it's probably a good idea to listen without your kids. Also, if this is the first episode that you're downloading, hit pause and go back and listen to the first couple episodes. They build sequentially on one another, and it's part of a conversation, a full conversation. Though you can listen to any of them individually as well, if you so choose. As healthcare providers, it's vital that we have a level of understanding of just how deep mental illness can run. That it's not only okay, but absolutely necessary that we talk about it with our patients. Something very, very important to note, neither Zach nor I are practicing providers of mental health care. We and Sean are very, very clear that nothing we discuss on this episode or those to come should be considered in any way as medical advice. The three of us strongly encourage anyone listening to contact your local doctor for a referral to a mental health care provider if you're struggling with mental illness. Likewise, if you're listening to this and you're considering ending your life, please don't. You can call 911 or the National Suicide Prevention Hotline at 1-800-273-TALK. That's 1-800-273-8255. That's a good number to plug into your phone. Keep it as one of the speed dials. The National Suicide Prevention Hotline provides free and confidential emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week, anywhere across the United States. They are a national network of over 160 crisis centers combining custom local care and resources with national standards and best practices. So why don't we get started? Zach, Sean, welcome again to the fourth installment of this mini-series on mental health and public perception.
Hello, Dave. Thank you again. And hi, Sean. Thanks again for joining us.
Hello, guys. Thanks for having me.
Well, Sean, I'd like to go ahead and take our conversation and step back even further. So we had spent a couple episodes talking about really what has been going on with you personally and your experience. Then in the last episode, we stepped back into our relationships, and you shared a lot of how your experience is related to your relationships with your mom, with your spouse. And so now I'd like to step back even further and talk about greater society and talk about public perception of mental health and mental illness. So this is really valuable, and really the whole purpose of this series, right, is to talk about stigma and to talk about stigma specifically of mental health. So could you just reflect on your thoughts of public perception of mental health, mental illness in general, maybe specifically for things that you've been working on, and how that's affected you?
Yeah, we'll just kind of do a little thought experiment. Everyone who's listening, go back to when you were a kid and whoever the crazy person was in your town. Put yourself in those shoes again and think about kind of what was said about that person, the stories that were spread about that person. In my small town, there was a specific guy who was like the crazy guy in the town, who obviously had some mental issues. That's where stigma is born, when you have somebody that's the stereotype extreme version that becomes the poster child for mental illness, depression, schizophrenia, bipolar disorder, you name it. And then you even think about kind of the lingo that people use. Boy, the weather is sure bipolar today. No, the weather isn't bipolar. not even remotely. Those kinds of lingo, off the cuff kinds of things kind of make a mockery of mental illness as kind of a joke, is for people that are weird and outsiders and kind of the people that don't fit in society. And so what it does is it creates this broad brush effect. So now you start to put everybody else in that category, like, oh, you have depression? You mean like the crazy guy in my building? Or, those kinds of things. That's kind of where stigma is born. It's basically, if you kind of boil it down, it's like a really nasty stereotype, where you throw people in a bucket. From fear and misunderstanding come all kinds of crazy labels and assumptions on what people with mental illness look like and are like.
Right. So stereotypes. Could you talk a little bit about maybe any experiences that you had personally of maybe when you felt like someone made a quick judgment of you personally based on any stigma of that?
Ooh, that's a really good question, young man.
That's why I pay him the big bucks.
I remember, for one instance, I remember somebody finding out that I'm in Mensa and not being able to calculate how I could have a high IQ with also having a mental illness. Like, supposed superior brain power should be able to overrule mental illness or something. I don't know exactly how that works for them in their brain, but I know in my brain, just because I'm really good at solving problems and thinking abstractly doesn't mean that my brain also doesn't tell me to kill myself. And so, so that's maybe the first example that comes to my mind of people not understanding, like you can have thoughts and opinions and be able to function and still have mental illness. That's that's hard for a lot of people to comprehend. They don't realize that most of us with mental illness are functioning. We're everyday people like you two wonderful guys.
Well, an interesting thing is that even among healthcare providers, there's this issue. And so as providers, specifically in physical therapy, we might see illness as, say, if someone has a physical ailment, that we might understand that, this person didn't choose this ailment that they had, that they might be wonderful people trying very, very hard, and it's okay. It's just this happens sometimes. And yet, I'm not sure that I see that same approach to mental illness, even among healthcare providers. Sean, could you talk a little bit about that, your experience there?
Oh, absolutely. As a therapist, I've been in the back room where another therapist will kind of mockingly make light of, my patient opened up. First thing she said is, I'm bipolar, so you know how that treatment's going to go. Like those kinds of things. It hurts. It really does. Those people are my tribe. And while I might not be in the same boat as them in their particular illness, those things hurt personally as well. And I think a lot of it just comes from a place of misunderstanding, or it's amazing that you can have somebody who's maybe has a doctorate degree, but is still really ignorant about a particular issue. Obviously it's very possible. Hell, even so, I'm just getting started with this new psychiatrist, and this should have been my first cue that I needed to keep looking for a new person. But I was explaining my 2016 year in review. I had all these great professional accomplishments and all these really cool things that were happening for me. Even personally, kind of really big things going on with the success of Get PT First and speaking at CSM and state chapter conference and all these different things, and getting into Mensa and all these things. But like right in the middle of it all, I had a major depressive episode, and I still can't believe that she said, well, you have all these things going for you. Why are you so depressed? Like, I don't know. Why? That's why I'm here. Kind of like what kind of mental health care provider are you? Like, that's the dumbest thing I've ever heard in my life.
So just a failure to recognize the difference between a circumstantial depression and like an actual biochemical, thing going on. Awesome.
Yeah, I don't know. I mean, I can understand the lack of knowledge or the misunderstanding in like the physical therapy world. It's unfortunate, but we're not trained on it a lot in school, and there's still a lot of stigmas that carry over from growing up and all those things. So I mean, I know that's going to happen, but to even have those kinds of situations with other healthcare providers, especially in the mental health world, it's really unfortunate, but it happens.
Right. It's extremely surprising to hear that, because you'd think that someone who is actually a mental health care provider would see that there's this difference. You might have all of this success, everything going on for you, and yeah, you still have these biochemical processes going on. It doesn't mean that you can't be successful, right? There's countless examples of people who have had success, who have been able to really function, but also have this really troubling mental illness at the same time. So Sean, could you talk a little bit about maybe what were some things that your providers have done that you really appreciated? Maybe this example is not that, right?
Well, you know what? In every profession, in every circle, in every group of people, you're going to have outliers. You're going to have the excellent providers, and you're going to have the poor ones. It's just a fact of life. I don't begrudge the whole mental health profession about that. I just chalk that up to that's just unfortunately a provider who just doesn't get it. But in to balance that out, one of the people that's given me the most hope is my therapist, counselor, whatever you want to call him. When I go to therapy, we focus on more of, there's different techniques. You can talk about cognitive behavioral, and there's a bunch of different flavors of therapy out there. But what seems to really work well for me is more of like that existential thought process. What is your purpose? What makes you you? What do you live for? And that's been very, very important for me, is talking with John and going over those things, like, even when the crap hits the wall, what kind of purpose do you have? Because that holds much more than emotions that can drag you in and out like the tide. Trying to focus on things that are much more concrete, because there are a lot of times where I feel very hopeless, like, wow, I've been dealing with this a really long time and it's just not getting better. You really start to have those really dark times where you contemplate, would people really miss me? Wouldn't my family be better off without me? And so when the best thing that he's helped me with is to kind of recenter myself by saying, what am I here for? I'm here to take care of my girls. I'm here to make a difference in this world, in those kinds of things. I've had a lot of really good tips along that same line from other providers where, they don't pretend to have the magic words to fix it, but they can kind of help point you in the right direction.
So let me take it back just a little bit. How do you access the right provider for you? You've talked a little bit about how you've been through a few different providers, and things aren't getting any easier. The three of us know that every physical therapist isn't the same. The patient that's going to do really well with me may not do all that great with someone else. And it kind of goes on and on. But how do you go about finding and advocating for yourself as a patient, and finding the right provider that fits you?
It's really tough, especially having a mental illness, to be able to say, it's just not working between us. I think I need to find somebody else. But if they're a provider worth their salt at all, especially in mental health, they know that this is a really personal issue. If you think physical therapy can be personal, this is an incredibly personal issue. And if you don't have a good fit, if you don't feel comfortable completely with your mental health provider, then you really owe it to yourself to find somebody that you're really comfortable with. Because in some ways, like in my way, my life is kind of in their hands, and they could kind of screw it up pretty bad. So I need to be able to trust them that I can be completely vulnerable and be as honest as I possibly can, and to know that they're, looking out for me. And without that level of trust, you can't, especially from when you talk about like the therapy part of it, it's different maybe from psychiatry when you have somebody who's managing medications and things like that. But especially on the therapy side of things, it's so important. And it's uncomfortable. And if they're a good therapist, then they don't take it personally, because that's just how it goes. I've had a few different therapists that I've worked with and all that, and sometimes it works out great, and sometimes it's awkward, and you need to find somebody else. But you have to stand up for yourself, which is really hard to do as someone with a mental illness.
So, as far as stepping back to outside of those in healthcare and say, let's think about as society's view of mental illness and stigma. Why do you think that stigma is there for? And let's talk specifically about depression, because really for mental illness, there are some types of mental illness that people might not have that same stigma for. Say, for example, if someone's obsessive compulsive, right, there might be a different connotation to it. But you might think, well, they just want it their own way. And, that's different from someone who's depressed. Why do you think that stigma is there for depression?
And also just to point out, Zach, I mean, the stigma may not also be there for somebody who's returning from, say war, for PTSD. There's something
Right.
that you can actually touch that happened, and, not unlike what we see in a clinic. There's something that happened. There's something that's happening now, and potentially some kind of treatment for it. Something that's a little bit more, organic in nature. Interesting.
Yeah, there are no objective tests where I can just do like some blood test and like, whoa, you are depressed. Holy crap. It's a completely subjective thing. You kind of have to take my word for it. And for a lot of people, that's just really hard to do. And I understand that. It's just, that's part of the stigma itself, is not being able to see it, not being able to put your hands on it and say, this is it. Not being able to have a direct result. Grief is easy to empathize with somebody, because, you know what happened and in the process, and a loved one passing away or something like that. That makes sense. But if you've never been depressed, not sad, but if you've never been depressed, there's really nothing I can say to you so you could experience it. I mean, it's got to be in some ways kind of like trying to tell someone who's blind what it's like to see. Unless you can really experience it, it's it's not something that is easily put into words. And again, yeah, it's something you just kind of have to take somebody's word for, and that's really hard for some people. There's thankfully like celebrities. I think of first like Kristen Bell and other actors and actresses out there, and celebrities and musicians that have come forward talking about depression and their personal battles. And I think that's helped a lot. I'm all for that kind of stuff because it helps to put a face on it. And I think that's part of where stigma lies is this abstract thought of it's those people over there. But when you can see kind of a human face on it, somebody that maybe you admire or you at least know that has this illness, then it becomes more real. And it's not just about them, it's about this person. Unfortunately, I think in some cases when celebrities come out and say, I battled with depression my whole life or this or that, some people say, well, how brave of them, but then they're not willing to show that same love and grace towards, their neighbor who has it. It's one of those things where, it's okay for a celebrity, but it's not okay for my coworker, kind of a thing. So there's that stigma as well.
Right. It's really great when someone can, as a public figure with actually so much influence, to be able to share that experience, to be able to talk about what's been going on, so that those in general public can also have that conversation, can also say, oh, that's interesting. The royal family, they're talking about mental health. Huh. Like, oh, you know what? That makes me think of whoever, and then start to talk about it, and then when they wouldn't have talked about it otherwise. Because really, I think a big part of the stigma is that in American cultures, in different parts of America, there is this total unwillingness to want to talk about things like depression or anxiety because of a fear that it shows some sort of character flaw, and that shows a character flaw of you if you have it, but also a flaw of your son if your son has it. Therefore, it's this sort of stain on the pride of your family that there's this flaw of this person. And I think that really conversations like this can help us think about, is it really a character flaw? Is that really the cause of mental illness? And the overwhelming evidence is that no. So, Sean, do you have any reaction to that? Any experience with that personally?
Yeah, I mean, again, when I tell my story, I'm really in the back of my mind fearful of sharing it because I know how that story gets played out in somebody else's brain. Like, if you know everything else about me and my accomplishments, you might think something else, and then you find this out about me and everything changes. Instead of it being, wow, I didn't know that he had depression, it becomes like you see everything about me through that filter. And so, I am not depression. Depression isn't me. It is something that's a part of my life, but it doesn't define who I am. And unfortunately, once some people know that story, that's how I'm defined, according to them. And it sucks. It sucks, but it's unfortunately kind of how it is for certain people. And that's why it's important to kind of share these stories. Like you said, as more and more people share their story, it becomes more personalized and more real to people. So, and hopefully dropping some of those barriers in the process.
That begs the question then, Sean, why, I guess, why now? Why is the timing of talking about this a little bit more publicly, starting your Mental Health Matters campaign? Why now? Why here? Why this vehicle?
Yeah, those great questions. Mostly I'm at a state in my healing process, in my journey with this, where I've weighed it out, and the benefit of potentially helping somebody else And being a force for change and a force for good is worth it to me to inconvenience myself and have uncomfortable conversations. Part of it is being encouraged by someone like a Kristen Bell, who has been very open and willing to share her story. A lot of it has been by the encouragement of my therapist. You know what? Every time you tell the story, it gets a little bit easier. And the amazing thing is, when you keep it bottled up, it has a lot of power over you. And so by vocalizing it, by getting it out there, it's amazing how incredibly freeing it is. Like the first time I shared one of my posts on living with depression, it was amazing to me, and it has been ever since I've started doing this, how many people have reached out to me privately and said, wow, me too. I could never possibly ever share publicly what you've just shared. And you know what my response is a lot of times is, I was in your shoes, a year ago, and I'm just at a point right now where I'm okay with it. People are going to draw conclusions and people are going to judge and people are going to make terrible assumptions, but that's really their problem. Right now, it's about me trying to make this place better, especially for my girls, knowing that my girls now have this wonderful family lineage of depression. I am going to do everything in my power that if they have these issues down the line, that they are going to live in a world that is more comfortable talking about these things, getting help, reaching out, building bridges, that kind of thing.
Awesome. And that makes me think of the post that you had written on the Mighty that was really addressing your daughters, and it was incredibly powerful. Could you talk about how other parents who may be going through similar things, maybe things that you have learned as you have a daughter? How old are your daughters again?
8-year-old and 5-year-old twins.
Wow. So could you talk about some things that have worked really well and some things that have helped for other parents who may be dealing with mental illness?
Yeah, it's tough. Some parents will see it as them failing their child in some way. If their child is showing signs of mental illness, it's hard not to take that like personally, like you caused it or you failed them. Well, I guess potentially that could be the case. In most cases, it's some parents are just afraid to deal with the situation because once you bring it out into the open, into the light, then now you've got to deal with it. And they'd rather just kind of keep it kind of under wraps and hidden. So what I would recommend for parents is, kind of the same thing that we had talked about in the last episode is getting counseling, not only as a family, but for yourself. There's a legit grieving process to go through when you find out a loved one has an issue, whether it's like a terminal illness or cancer or, maybe a significant mental health issue. You're not expected to deal with all these things on your own. You can legitimately get help for them. And it's really important to reach out for that as well. So that way you can respond to your kid in a way that's helpful instead of shaming, or instead of appearing like you're, ashamed of them, that you can be supportive and actually know how you can support them. Right.
And that reminds me of how in a previous episode we have talked about the intensive outpatient program that you're in, so could you talk a little bit about what that treatment looked like? So for those who are wondering, like, what is this therapy that you would get for this? Could you talk a little bit about that?
Yeah. I was kind of at a point where we were deciding if I was going to be doing like an inpatient type of a commitment, or if we were going to look at different outpatient settings. And one of the options that was available for me, and depending on where you live, might be available, is this was called like an intensive outpatient. So you're going for maybe 3 to 5 hours at a time during the day, maybe anywhere from 3 to 5 days a week, in group type settings, where you can kind of share in your own struggles, victories, defeats, learn techniques together, learn from each other, in that kind of a environment. I'll be honest, I hated it so bad. It's so uncomfortable. But there's this incredible beauty in being in a room with, I think there was roughly like 12 people in my group, with all of us had some pretty serious issues, but we're all just completely open and honest about it. You've got 12 people with serious issues, and we're at the end of ourselves. We're done trying to hide it. We're done trying to cover it up. We're all in like crisis mode. And to see people from different walks of life, from wealthy to incredible poverty, from really disastrous home lives and home situations to people with relative, good family constructs, people that take part in like cutting and self-inflicted injury, to alcoholics or other drug using addicts. You've got people like me that are suicidal and depressive, other folks with borderline personality disorder, all these kinds of things, where you realize that when it comes down to it, that we all have a lot in common, even from all different walks of life. And that was the thing that struck me the most, is when you get those people together, how much you can learn from each other. And encourage each other. Not that dissimilar from like something like an Alcoholics Anonymous type of thing, where, these strangers can get together, share in your struggles and victories, and kind of work it out together.
That's great. And it's really powerful to think about how your image of certain conditions may have totally changed based on your conversations there, and vice versa, of how others who may be dealing with different circumstances, but this similar core theme of an intense personal struggle, and how that conversation can really change your perceptions of what's going on. And
absolutely.
Go ahead.
No, absolutely. It manifests in different ways. I have this incredible emotional pain deep in my soul, and almost a self-hatred, and in the depths of the depression. The only thing different for me than the guy next to me who shoots heroin is that he found a very unhealthy way to deal with those things. You have the person across from me who is goes into self-harm. The next person over who's an alcoholic. We all have this incredibly terrible thing going on deep in us, and it just manifests in different ways. There's really nothing significantly different in us. We just ended up on different roads. We had the same problem. And when you realize, when you look at the larger community, especially when you look at like the homeless community, I can't help but wonder how many of those people, if they had just gotten legitimate mental help, would be with their families, productive members of the community. I've done work with the homeless before, and you find out that a lot of them just had mental illness and maybe didn't have a good support system, and one thing leads to another, and alcohol, drug use, and now they're homeless, and now the cycle really gets really, really bad. And who knows, that could very easily been my story as well. When you meet those people face to face, you realize, it's not a stretch to see where I could be in this whole mix.
Right. It's really powerful to see how, if things were just a little bit different, if you didn't have that support system, whether it's your spouse or your parents, or if there's something else about you that if that were taken away, then what would happen? And that's where it really is something that can change society, is to really think about how you're really not that different. And really, like you said, something gets manifested differently. One, based on your own uniqueness, but two, based on external circumstances that you can't control, whether it's your family support, whether it's the community you live in, the resources available to you, whether or not you even knew that mental health counseling was an option, right? A lot of these things, that if they were to go in this different direction, then something would have been totally different. And that lack of awareness of how this could happen to anyone is at the core of why there is stigma, is if we might interpret this situation as like, well, that wouldn't happen to me because, I'm better than that, but really you're not all that different, because there are other ways that you were fortunate to allow that not to happen to you. So what are some other things that we could be doing to help eradicate that stigma?
And that's kind of where I'm at with what I want to do with like the Mental Health Matters, Hope for Mental Health accounts. We need to get the stories out there. It's the articles I've written for The Mighty, really cool organizations like To Write Love on Her Arms, Project Semicolon, these other great organizations and movements out there to put a face to mental illness. We need to be better in the community about engaging one another, building those bridges, and starting to have the conversations. It's going to be really, really awkward, and there's not one easy, quick solution. It's going to be a long process of as is with any type of lack of education or ignorance about certain issues. It's not just, here, read this pamphlet and now you get it kind of a thing. It's going to be a long process, and it's going to be messy, but it's going to be worth it too.
The last question that I have, Sean, this being the fourth episode, and really the last that we had any kind of content necessarily planned for, what questions did we fail? Did we miss? What were you hoping to ask? What were some of the ones that you were dying to answer?
Was that a suicide joke?
Oh man, it's 11 o'clock, everybody. I'm not thinking, and
oh, you didn't know this, but when somebody's suicidal, they can joke about suicide. But when somebody else isn't suicidal, I'm totally messing with you.
Yeah, and if it's a good thing this is not a video thing, mostly because I'm all kinds of red, totally unintentional. I have plenty of different jokes. Typically don't joke about suicide.
No, I've got plenty of good ones that it typically makes people uncomfortable. So I'm glad that you could break the ice on that one.
Oh, hey,
so
anytime.
Thanks for that.
If you need an inappropriate joke, Sean, I'm your man.
I'm dying to hear it. No, part of me is, I obviously know what it's like to be in this head, and it's pretty scary at times. I don't necessarily know what it's like to be on the outside. So I'm willing to talk about it. I'm obviously giving you a hard time, Dave, but I appreciate your questions, because there are plenty of times in life where we just assume that the other party gets it, or we assume that the message is coming across correctly. And rarely is that ever the case with assumptions. So part of it is I'm very curious, like, what kind of questions do you guys have? What kind of thoughts do you have? I mean, I can give plenty of my own experiences. I don't know how much of that's, worthwhile to other people, but I'm glad to share it. So, that's kind of where I'm coming from.
So let's do this. Why don't we toss it to the listeners? We'll post it, and we can post it on the Facebook page at the Senior Rehab Project, of which the Voice of the Patient is a proud member. We can post it on their Facebook page and toss it to the community. They'll hopefully shower us with questions, and we'll have maybe 1 or 2 episodes more, depending on the conversations that get started from some of those questions. So to kind of wrap up the content here, I just wanted to thank again our guest tonight, Sean Hagey, for your openness, for your honesty, for your sharing, and for just really coming forward and really driving home the importance of mental health as something that we need to be talking about, and we need to be talking about more. Again, we'll go ahead and throw it out to the group on the Facebook page for the Senior Rehab Project. But until next time, everybody, keep listening to the voice of the patient and take care.
If you enjoyed this episode, go to thevoiceofthepatient.org, where you can find other helpful podcasts and blog posts that will show you how to improve healthcare through not only hearing, but truly listening to the voice of the patient. Thanks for listening. This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.